Picture-wise, is the lighting looks good? Fine?
Yes,
Yes,
perfect.
Perfect. So yogis has to be light, camera, action.
This is a new new way of
No,
teaching.
it's a union of your body, mind, and spirit. When a body, mind is, you're united, everything is perfect. We do every morning, we do jalneti, so we do have some drainage throughout the whole day. That's our part of our daily, we call it a daily routine, dinacharya. Okay. You will give me a cue when you want me to start,
Sure.
or if you want to introduce, or if you want to introduce any way you want to do, is fine with me. This is from your yoga talk.
Hi, Denise.
Hi.
She's the studio owner from Philadelphia. Dilip ji. Perfect. So, Dilip ji, how you got started with yoga when you were very younger?
Actually,
It's all yours.
see, we come from India, so we have, yoga in our daily routine, daily blood. We wake up in the morning, we did some, and believe me or not, back home, we never knew. Grandfather is doing it, father is doing it, I'm doing it. It was a part of our life. So I came to United States when I was very young. I was in my 19 or 20, I think, at the time. So I was in training, and I became, a cardiac surgeon, cardiovascular surgeon. So I was totally a Western trained mind. So I was exercising 5 days a week, eating right kind of food, doing, every known wellness in our Western medical system. And 2001, I had a heart attack. And I had emergency triple vessel coronary artery bypass. And believe me, everything was normal. My blood pressure was normal, my blood sugar is normal, there is no risk factor. I don't have any family history that my parents lives up to mid-80s and 90s. I don't have that big a truncal obesity, which is another risk factor. My blood pressure is still 120/80, blood sugar is 80, cholesterol is 160. So, question came, why me? And my cardiologist says, we have nothing to do. We give you 4 medication, aspirin, statin, beta blocker, ACE inhibitor. And then it struck me, start doing little relaxation, we were exercising every day. I was a surgeon, I was operating, and I was like a stick. I could not even turn, bend, do nothing. I had a lot of other symptoms called irritable bowels and other issues. So started doing a slow, very progressive, and in steps, asana practice, pranayama, meditation practice. And within a few months, I started noticing changes. And both in my physical body became very relaxed, loose, almost sort of like an emancipation. The pranayama, and then all my whatever defect I have in my myocardial perfusion scan and everything started getting better and better. So make a story short, within 3-4 years, I started negotiating with my cardiologist. I slowly cut down my medications. And guess what? For the last 15-16 years, I've not touched a single pill. I'm off medication, I'm disease-free, medication-free. But I do practice every single day. Instead of taking pill, I practice. And slowly, all my physician friends started noticing it. They started asking me to share what I do. Started sharing, and then one after another. I'm sure you have seen my bio, I became a president of International Association of Yoga Therapists. I was the president for 5 years. I have, connected lecture every medical centers you can know, starting from MD Anderson, Cleveland Clinic, Harvard. So now, primarily I teach called continuing medical education for the physicians, how to integrate yoga therapy in Western medicine. And I don't know if you have seen my book. I have a book here, a book and DVD. Let me get a copy of my book to show it to you and all the participants. The title of the book. I also have multiple DVDs, but all for the healthcare providers. So, like, just to show you a couple of them. I don't know if you can all of your participants see? They may have joined. It's called Yoga Therapy, Ayurveda, and Western Medicine. And if you see one, there is a picture of Albert Einstein, and another is called Tagore. Say Einstein is a scientist, Tagore is a philosopher, and he said modern day medicine is when philosophy and science meets together. This is a DVD also called Yoga Therapy for Health and Healing, a daily practice. This is also all is your part of your daily routine, and all the asanas and everything in my book is all my postures, my asanas. Now this is about 250 colored pictures, asanas, pranayama, mudras, bandhas, kriyas, everything is here. Okay, so enough with the introduction. We can go ahead and start, or you tell me when to start.
It's all yours, Dilipji. Please. Thank you.
I see you, so I'm not in the spotlight for everyone. So okay. you go to spotlight
for everyone. Perfect.
Yeah, put me spotlight for everyone. And I'm going to recording it too. Okay. Good morning. We're from all different time zone, but it is morning in United States. Today is Sunday, February 21st, 2021. I'm in the Eastern time zone. It's around little past 11. And we'll have a little workshop today called Yoga Therapy for Health and Healing. I will give you just a little brief description, but I will go for primary for the practice and show it to you. And primary reason is, in my book, yoga practice is 99% practice, 1% is theory. If you keep on practicing, every yoga will come to you. Now, let's talk about a little bit what this yoga therapy means and what yoga therapy is. Say, yoga, we call it a yoga. Yoga is the primary Sanskrit word. Yoga is the anglicized word we use. Yoga is the union, we call union of a body, mind, and spirit. And spiritually, it's a union between our Jiva-atma to Paramatma, individual soul to universal soul. And in a computer metaphor, you say, body is like a hardware, mind is a software, and spirit is a programmer. Who is a programmer? I am the programmer, and I'm programming my software, which is my mind. And I'm programming my software mind with the practice of yoga, and my hardware is taken care of. So remember, I'm using the word yoga because that is the word yoga, comes from the Sanskrit. I will be interchanging yoga and yoga, but I try to stick it to yoga. But in our Western medicine, we are primarily trying to fix our hardware. I have a blockage in my coronary arteries, I'm doing angioplasty and bypass. But in yoga practice, we said why you have the blockage. And primarily you see it is called Manomaya Kosha, the mind. We have 5 sheets, we'll talk about it. So primarily yoga today, what the practice is, it's a philosophy. It's a Yoga Sutra of Patanjali, 196 sutras, of which 193 is to quiet down your mind. Chitta Vritti Nirodha, controlling the chattering of your mind. Practice is called 8 limbs. Patanjali Ashtanga Yoga, 8 limbs. Yam, social restraint. Niyam, personal restraint. Asana primarily is a external and internal alignment. Pranayama is a voluntary regulated breathing. It's not a breathing exercise. Remember, pranayama is a voluntary regulated breathing. Pratyahara is control of your 5 senses. Dharan is the focus. Dhyan is the meditation. Samadhi is a union of your body, mind, and spirit. So remember one thing, meditation is the 7th limb of yoga. We always use yoga and meditation. No, we say yoga, asana, and meditation. And meditation is a state where you get all the therapeutic benefits. We call it that meditation is medication. For the preparation of the meditation, we prepare our physical body. We prepare our physical body through a relaxation response, through an activation of parasympathetic tone. And these in Yoga Sutra being described as Sthiram Sukham Asanam. Stillness, happiness, and asana. I'm sitting here, I'm still, I don't have any shaking the fasciculation. I'm sitting very comfortably, and this is the preparatory to my meditation. If I'm able to sit down in this asana pose, initially muscles and ligaments contracts, but if I'm able to sit down with a attention to my breath, and I'll show you what the attention of breath means, slowly and slowly muscle and ligament starts to relax. So there are 3 Sanskrit terms for asana. First one is called arambho. Arambho is the beginning. So I'm sitting here, I'm taking both of my feet underneath my knees, keep my spine straight, and quiet down close my eyes. This is arambho, beginning. If I stay here a little longer, the muscle starts to relax. Before the muscle starts to relax, muscle have a little bit of a twitching called fasciculation. And if you stay a little longer, the muscle starts to relax. That is called sthiti. Sthiti is a stability. The stability means I am able to sit down very comfortably. If you do a boat pose, like a Naukasana, when you do a Naukasana, you will see your body is shaking a little bit, but slowly and slowly it goes away. And finally, it's called a Visarjan, a profound relaxation, which is called our activation of parasympathetic tone. A sympathetic tone, which is our exercise does, is your fight and flight response. Blood pressure goes high up, respiratory rate goes up. And once they're up, body's homeostasis comes in place. Blood pressure comes down, heart rate comes down. You get a profound parasympathetic activation. In your practice, it is primarily a parasympathetic activation, which is called calm and digest. More and more you do the parasympathetic activation, you will see you have a saliva in your mouth. When you get a fearful and stress, you get your dry mouth. But when you're doing yoga practice, we get a saliva. We really don't drink any water during a practice. So yoga therapy basically means adaptation of these yoga practices based on your patient's or client's clinical condition. We have a physical condition, like I have a back pain, I have a knee pain, I have a hip pain. We start with some physical asanas initially. I have a respiratory issues, I have a asthma, I have a COPD, I have a pulmonary fibrosis. I start seeing what to do and how to handle my pulmonary issues. If I have some neuropsychiatric disorders, I have a depression, I have a schizophrenia, or have autism, a lot of neurological disorders, Parkinson's disease, multiple sclerosis, we know how to start with them. So able to learn what to use. See, we're using the same tools, the Yoga Sutra and Ashtanga Yoga, 8 limbs, but we are trying to find it out how to use it, and that is called your yoga therapy. And that is the reason is the whole Ayurvedic philosophy, all the bandhas, kriyas, mudras, which I'm going to show it to you and explain to you a little bit more, which will come in play. Now, what does a yoga practice does? Yoga practice is especially called a art of transformation. What does it transform? It transforms a rogi. Rogi in Sanskrit, in English called person who have a disease. Rogi to nirogi. Nirogi means person who doesn't have any disease, who is healthy. From nirogi, it converts into called yogi and yogini. When you get a yogi and yogini, you enjoy a beautiful quality life. And for all of your information, your practice is a part of our daily routine. It's called dinacharya. Your practice is a part of our lifestyle. We call it lifestyle medicine. Yoga is not that you are going to do 2 days a week, 3 days a week, 7 days a week. Doesn't matter how long you're sitting doing it on a mat. It is the whole timing out of the mat. So it is 24/7 practice, and which you do all the time. So what is the first practice? First practice is somebody who comes with a disease. What are the diseases today we know which are amenable to yoga therapy? First and foremost disease, which is clearly has a better result out of any, is your chronic low back pain. And if you want to look at it, if you want to go to say called PubMed, PUBMED. PubMed is the website for the National Library of Medicine. And if you go to PubMed in the search engine, if you put down just yoga therapy, you'll see 5,000 articles will come up. Plus, we have talking from our experience, from our observation, from our research. And also what is very important is when we are doing a yoga practice, we use it a health tracker. Here is my Apple Watch. Every time I'm doing it, I'm watching all my health parameters. So we have everything recorded. So what I'm talking about is from our research and experience. So for a person who is a rogi, he or she probably is not going to be able to sit down in the ground. So the primarily you say, when you even have a chronic low back pain, probably, or the knee pain, probably they won't be able to get down in the ground. So we said, let's sit down in a chair. Let's start sitting in a chair. Next possible disease, which is very amenable to yoga therapy, is called the chronic lifestyle related disorders, which you call a metabolic syndrome, which first starts with called a truncal obesity. This is called a spare tire. And this fat is inside our abdominal cavity. It's called omentum. And the omental fat secretes inflammatory molecule. It causes a cascade of phenomena. Diabetes, hypertension, heart disease, or the blockage of the arteries, high cholesterol, or dyslipidemia, and we call them as a metabolic syndrome. Yoga therapy is primarily, we call it a dhanantari. Dhanantari means the therapy for your metabolic syndrome or lifestyle-related disorders. Yoga therapy is very powerful in cancer treatment. People with a cancer, what happens? Yoga takes care of all the associated symptoms. Plus, today we have seen that cancer is due to call genetic expression. What does it mean? I have all the genes for my cancer. I have the oncogene for my thyroid cancer, breast cancer, lung cancer, colon cancer, but this gene has to express. Gene expresses with a phenomena called epigenetics. And your practice is nothing but counteracting the epigenetics. So if you see somebody has a breast cancer, you'll have a surgery, chemotherapy, radiation, they're completely cured. After 10 years, 15 years down the line, they get a cancer comes back. Why? Because that oncogene is still there and oncogene got expressed. A daily practice of yoga will call a suppression of your genes, and it is not going to express. So the way that yoga therapy is applicable to in our modern day medicine is called a primary prevention. And primary prevention means my father has a genetic disease, my father may have a diabetes, have a hypertension, have a heart disease, I'm going to have it. But with a daily practice of yoga as a lifestyle, I develop this called relaxation response, parasympathetic activation, which prevents my genetic expression. So it acts like a preventive medicine. Second, when I have the disease, like me, I had open heart surgery and a blockage in the arteries in the heart. When I incorporated this yoga as a therapy, it prevented the progression of the disease. It regresses the disease. It made me get rid of all my medication. This is called secondary prevention. A tertiary prevention is the prevention from your complication of a disease. Say a diabetes. A diabetes has a complication like diabetic nephropathy, kidneys, diabetic retinopathy. Practice of yoga will take care of it. Now let's go ahead and start how to start a yoga therapy practice. I'll show you some relaxation sitting in a chair, but if you're able to sit down in a ground, let's see if you want to practice with me is great. The component of your practice is, in Sanskrit, is called Merudanda Achal Manasthi. Merudanda Achal means spine straight. Wherever we sit down, you sit down in the ground, sit down in a chair, even if you're standing straight, always keep your spine straight. The moment keep your spine straight, what happens? See, our skeleton is going to fall in the front. All the back muscles are contracting, keeping me straight up. If I keep my body straight, I give a relaxation. So if you feel, on the side of his spine, it feels like two stones sitting here. By the time I do your practices, it feels like there are two pillows sitting here. Very important concept, spine straight. Next you do, if you're able to sit down, this is called a Sukhasana, easy pose. You take both the feet, put the feet underneath your knees, keep your spine straight and able to sit down. Now you look for two important body's symptoms. First is pain. If you get a pain, you create a imbalance to your physical body. You back off. Try to find a place where you don't have a pain. So you don't compete with anybody. You only compete against yourself. Stay here. Next component is mind. In your mind is called content of your five senses. What I hear, I see, I smell, I taste, and I touch. Close my eyes. The moment I close my eyes, my mind starts to quiet down. Next, my mind is connected through my body is my hand. Remember, if mind does anything, if my mind says, this is good, my hand will like this before muscle needs oxygen. So before muscle works, I'll breathe in. I'll breathe out, take a deep breath in. And during, if I'm doing weight training, breathe out. Breathe in, breathe out. So if you remember, breathe in before a muscle works. So if you're doing a back bend, breathe in, then breathe out. If you're using a tricep muscle, breathe in, breathe out. But in a yoga therapy, on a yoga pose, when you get into the full pose or even a partial pose, remember, you come to a stages. Wherever you can come, you stay in the pose. How long you stay in the pose? At least your body will allow you. Or if you're a bit comfortable, between 5 to 10 breaths. Remember, breath, breathing out longer than breathing in. So holding my hand to the back, looking straight, I'm breathing out first, slowly taking a deep breath in and putting my body down. My head will come all the way down and will touch to the ground. But what I'm looking for, no pain. should not have any pain, then I have effortless breathing. If my breath has any catches, I back off. But if my breath is normal, and how do I know my breath is normal? I'm able to talk. I'm able to even sing. I'm able to breathe. So my whole head will come down. And once it comes down, I stay here. I stay here between 5 to 10 breaths. So during your practice, you stay here between 5 to 10 breaths. So wonderful practice for your chronic low back pain and also for diabetes. What happens in diabetes, our pancreas is all the way to the back where the spine is. And in that posture, you get a profound sort of a massaging of the pancreas. It's almost like a twisting. Next one is a wonderful yogic asana or yogic asana practice is called your squatting pose, called Malasana. If you can do it, it becomes a profound relaxation response. All the yogis do it. You sit down and you're able to sit down in a squatting pose. If you cannot do it initially, you can come in stages. Initially, you can sit, hold it slowly, hold into a chair, hold the ground. Once you're in a Malasana, see, in a daily routine, first thing in the morning when I get up, I will sit down in this squatting pose in the Malasana, then I'll drink a glass of water. I'll take a water which I keep in my bedside and I will drink with one gulp at a time. Within a few minutes, I have a sensation for bowel movement. And first thing in the morning, I have a bowel movement. In Sanskrit, it's called Ushapanu. Usha is in the morning. Wonderful daily routine for the yogis. Then I use my hand. When my hand is relaxed, my fingers are all separated. When the hand is tight, so that finger doesn't go like this. So that hand is relaxed. Hand gets relaxed with a mudra called Balo Mushti Mudra, like a baby fist. Infant will put the thumb inside and close. When you put a thumb inside and close, you'll get all the hand get relaxed. Any pain, any arthritis pain, any problem with the hand and wrist gets relaxed with your Adhi Mudra. This is called Adhi Mudra, Balo Mushti Mudra. Wrist gets relaxed with extension. This is the relaxation of the wrist. This is the tightness of the wrist. Relaxation of the wrist, tightness of the wrist. So what we do, put our hands together, separate our fingers, and we extend our wrist. Take one elbow inside, take other elbow inside, slowly keep your spine straight, bring it close to you, hands are in front, keep your eyes closed, then you breathe out longer than breathing in, and stay here between 5 to 10 breaths. You will have a wonderful relaxation. Look at that. My ankle is relaxed, my knee is relaxed, my hip, back, all my thoracic area, my neck, my head, whole body is relaxed. It's a powerful yogic asana to create a relaxation response and parasympathetic activation. Whole gastrointestinal tract is supplied by parasympathetic nerve. So parasympathetic is called calm and digest. Once you get a proper digestion of the food, you don't have developed any more, we call it a toxic elements in your blood. Your blood sugar won't get high up, cholesterol won't get high up. Nothing, think about diabetes. We talk about, oh my God, it's a receptor problem, it's an insulin resistance, it's not about insulin. But for yogis, body cannot digest your sugar. Improve your digestive fire, it's called an Agni. This is nice. So I'm talking all this time for one reason, to see how long you'll be able to sit in this pose. This is called your Visarjan, relaxation. Next one is a powerful yogic tool, able to get up from here without a support. If you can get up without a support, Try this. We practice it all the time. Like we'll sit down in the ground, like your squatting pose, and you're able to get up without support. By the time you can do it, oh, all of you can do it, huh? Very nice. Let's do a little bit more challenging. So when the challenge comes, you feel better and better. These are called signs of health. Okay, I don't see you too many because I'm seeing you guys, but I see some of you. Now, if you can sit down, try this with me. Sit down like this, comfortably, all of you. Okay, then we'll see how good is your health. This is a sign of your health. From here, you get up without a support. All right? If you put one hand, you lose 25% of your health. If you put two hands, you lose 50% of your health. Let's try one more time. This is a fun thing. Beautiful way of measuring your health. This is called yoga's therapy. Now do the opposite. Cross your feet opposite way. Sit down comfortably. You know, it's not that I can do a headstand, I can do a shoulder stand, I can do a peacock, I can do all of them. But this is your health. From here, get up without a support. By the time you do it, it is we call it a money back guarantee. Your remember, yoga therapy, even if it is disease specific, it is called holistic. All the underlying chronic condition will get better. When you sit in a chair, you will sit down with your spine straight. So the way it is, if you're sitting in the front, my whole body will be like 90 degree. If you sit in the back of the chair, go to the back of the chair, keep your spine straight. And this is the way you will be sitting, you'll be eating your food, you'll be driving your car 24/7. The moment you keep your spine straight, that is your yoga therapy. Yoga therapy will get better. Your whole upper body, the chest expansion is called Bakho Bikash, chest opening poses. Chest opening poses improve your breathing. Pranayama, I'll show you a few pranayama, but preparatory to pranayama, you need to relax and you need to expand your chest. Then your neck is very tight. Neck is very tight and neck needs to be relaxed. So the chest opens up, it's called a Paschim Namaskar. Paschim Namaskar is putting a prayer pose to the back. And the neck movement or the fore movement is called a Brahma Mudra. Then we have another pranayama called a Bhramri Pranayama, Bumble Bee Breathing. What a Bumble Bee Breathing does, it controls our five senses. Then I have a frequency. My brain has a frequency. I create a frequency. It's called the frequency of the brain, which is like a sound of a bumblebee. Two frequency cancel, interacts, and you get a profound level of relaxation. Remember, in a yoga practice, you do asana first, then pranayama, then the meditation in sequence. But here in yoga therapy practice, you mix and match based on your underlying condition. Let's do one bumblebee breathing, Bhramri Pranayam. Then you will see I will incorporate bumblebee breathing during my exhalation with my neck relaxation. The best way to do it is that you can put your index finger in the forehead, use your three fingers to close your eyes, use your thumb to close your ear and close your mouth. You'll be doing all the breathing through your nostril, not through your mouth. You breathe out through your nose, take a deep breath in, breathe out with the sound of a bumblebee. It literally quiets down your mind. Next you do, take your both the hands, keep rubbing your hands. Keep rubbing your hands. It's called pumming and cupping. And if you're wearing glasses, you remove your glasses. Take both the hand like a cup. When it's warm, put the cup over your eyes. Let the eyes take all the heat from your hand. And slowly massage your forehead, massage your eyes, massage your face. Ear, behind the ear, front of the ear, inside the ear canal. This is called a auricular branch of vagus nerve. It stimulates your vagus nerve, which is a parasympathetic activation. Then you massage in the neck. There is a two organ called a carotid sinus. Carotid sinus also activates your vagus nerve. This is the way you bring the relaxation response. Able to sit down in a, this is called a Vajrasana. Able to Vajrasana is a powerful relaxing asana. So the way to do it is that people say always as an issue, you can sit down slowly first on your heel, but keep your spine straight. Once you keep your spine straight, slowly drop your feet down and able to sit down in a Vajrasana. Vajrasana is a very powerful relaxing asana. This is the one asana, we used to see our parents and grandparents after eating a meal, they used to sit down, Vajrasana. So say, if you can do a prayer pose to the back, let me show you in my back so you'll be able to see what I'm talking about. You take your hands and slowly bring it. If you can bring it here, it's very nice. Slowly put it down as a prayer pose to your back. If you can do a prayer pose to your back, keep your spine straight, keep your eyes closed, and then slowly and slowly you will see your hand is going to go high up. Longer and longer you stay, higher and higher it will go high up. And you'll stay in this posture. You'll stay in this posture with the breathing out longer than breathing in. Try with me. See how wonderful practice this is. This is called prayer pose to the back. Paschim Namaskar. I hope I don't see my back. You guys could see it well. Okay? Now, what you can do, if you are, as I said, you are rogi, you are disease-ridden, you cannot sit in the ground, sit in a chair. Sit in a chair. Use your prayer pose to the back. Put your hands to the back. Slowly get into a Paschim Namaskar. When you get into Paschim Namaskar, you stay in the Paschim Namaskar. Now relax your neck. Neck is the most tightest part. We get all the pain in the neck, and you get a pain called a radicular pain. Remember, all the pain comes from the tightness of the ligament, tightness of the muscles. A herniated disc, spinal stenosis, do not cause a pain. It causes irritation of a nerve, contraction of a muscle. So when you have a neck pain, when you have a back pain, if you go to a doctor, medication, they gave it to you. It is not the pain medication which relieves the pain. It's relaxation response. And I'll show you how to do relaxation response. Now, neck is called a Brahma Mudra. There are 4 postures, front and a back, side to side, looking all the way to the back and turning your neck all around. You will be doing with your eyes closed, and you'll do with a Brahma Pranayama, Bumble Bee Breathing. And let me see how wonderful practice it is. What happened in the Bumble Bee Breathing, you extend your exhalation. And we say, when you extend your exhalation, you extend your longevity. As simple as it is. So here, first, in all yoga practice, you breathe out. Take a slowly deep breath in and drop your neck to the back. And then slowly drop your neck in the front with the sound of a bumblebee. It's a profound relaxation response. And you have seen, extend the exhalation. So what you're going to look for, we'll look for pain. When you're dropping your head down, if you feel any pain, you back off. Or if you feel any effort in breathing, that you cannot talk, you cannot sing, you back off. Always remember, do not, this is very important, do not practice yoga asanas or any body posture protection after taking a pain medication. Do not take 2 Alvid, do not take 2 Tylenol before. If you have a pain, I will show it to you how to relieve your pain. So let's do the other 3 postures, a side to side, same technique, eyes closed, breathe out first, take a deep breath in. Look all the way to the back without moving your shoulder. Turn your neck from the left to the back to the right, then from right to the back to the left. A next pranayama is called a Bastrika Pranayama. Remember, pranayama practice is you breathe out longer than breathing in. Because lung is a balloon, it is full of all the carbon dioxide. You have to remove them to get the fresh oxygen. Oxygen is a relaxation. Bastrika is an active inhalation and active exhalation. Bastrika is a pain medication for yoga. What the Bastrika does, it brings more oxygen in, it converts glucose into your aerobic glycolysis. Water, carbon dioxide, and ATP. ATP is an energy. If you don't have enough oxygen, it's called anaerobic glycolysis. Anaerobic glycolysis creates lactic acid pain medication. So now say I have a knee pain. What I will do, I will try to bend my knee when I have a less pain. So if I can put it here, it's good. Somebody may not be able to do it. So what you can do, you can get a little bit of a stool here. Just put your foot on a stool when you get a knee pain. So comfortable discomfort. Then you close your eyes and you do the Bastrika Pranayama. You see how to do active inhalation and active exhalation. Bastrika is like your bellows. In my hand, I do relaxation. It's called Adhi Mudra. Put a thumb inside and close. Put it over my knees. Then I'll be doing. Within a short time, you'll see you started getting a relief of your pain. May not happen today, may not happen tomorrow, and slowly it will happen. And what happens, your breathing will be totally effortless. And if you can keep it, how long, everybody asks me how long I will do. You do it what your body will allow you without any effort in breathing. Then when you can do it a little longer, Generally, the practice we do 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. And let me show you another wonderful practice. It is called your eagle pose, Garurasana. You'll be doing sitting in a chair. Suppose you have a knee pain, and which you'll be able to do it. Standing up is very difficult when you get a knee pain and a hip pain. When you get a knee pain, hip pain, and all the joint pain, slowly and slowly you take your one foot, take it to the slowly, and take a turn today, tomorrow. This is called neuroplasticity. Neuroplasticity means my brain gets a signal. My brain gets a signal, more and more signal it gets, it becomes like a habit. So my foot will come, go behind it. I'll sit like this. I will sit like this, maybe whenever, even all the time. But in a practice, what I do, I will do a little rapid Bastrika Pranayama with a seated eagle pose. Let me show it to you. If you want to do with me, it's a wonderful practice. Or let me put my hand here, or let me put my hand, both my knees, it will be very nice. No? Like this. Little rapid Bastrika Pranayama. Just a simple 100 of them. I can keep doing it. I can do it 200, 300, 400, 500 with an effort. But you see, this is what yoga therapy means. We are using your same tools, but we're using in different way for different disease condition. So same way, what you will be doing here is called a Kapalbhati Pranayama. Kapalbhati Pranayama is Kapal and Bhati is a shining. You have a one balloon here, you have a diaphragm here, another balloon here. You bring your awareness to your belly button, you push your belly button to the back, it will massage all the abdominal organ. It massages your liver, spleen, pancreas. Then what it does, air will come out. It's called a active exhalation, passive inhalation. So what is good for it is that it is called a detoxifying pranayama. It removes all the toxins from my body, and it also activates my, what is called an Agni, Jathar Agni. It is called my digestive fire. It ignites my whole body's radiance. It's called Tejas. Prana, Teja, and Ojas. Tejas is a glow around my face. And that's where name came from. Kapal is a forehead, Bhati is a shining light. So it looks like there's a light around my face. And you will see all of spiritual lyrics, say picture of Buddha, picture of Jesus, and you will see there is an aura around their face. And you keep on doing yoga, you see aura around your face. So what you do, you incorporate this Kapalbhati Pranayama with your asana practice, the relaxation. And let me show you first just simple Kapalbhati Pranayama. And we use different mudras. In hand mudra, when you touch your index finger and thumb, it is called your Dhyana Mudra or a Gyana Mudra. Put the index finger down, it is called a Vayu Mudra, controls your pain. Touch your middle finger, it's called a Shunya Mudra, it controls your hearing. This is called your Prithvi Mudra. It's a grounding, it's very good for a diabetes and obesity. Touching your little finger is called a Varun Mudra, controls your bladder, controls your water content. This is the middle ring finger, thumb. This is called your Shakti Mudra or a Prana Mudra, brings your strength in the body. Middle finger, ring finger, and thumb. This is called Apana Mudra. So what we do the Kapalbhati Pranayama. We do Kapalbhati Pranayama is called Prano Pradhan Pranayama. Agni Pradhan Pranayama. It ignites your Agni. Bastrika Pranayama is called a Prano Pradhan Pranayama. It brings prana in your body. So I have touch my index finger and thumb, close my eye. I always practice the closing my eyes. So I really don't know what other people is doing, and it activates my parasympathetic tone. So I'm talking to you for an hour. My mouth is still wet. I have a lot of saliva in my mouth. That's a parasympathetic activation. So I bring my awareness to my belly button. So you keep on doing it. If you're doing it with me, and let me tell you what happens. This is a massaging the abdominal organs, massages your liver, massages your stomach, massages spleen. So how beautiful it is massaging. And it relaxes the whole abdominal wall. Keep doing it very slowly, 1 per second. Close your eyes, keep doing it. How long? As long as your breath will allow. Initially, it could be 30 seconds, 1 minute. But when you're comfortable doing it, keep on doing it for 5 minutes, maybe 10 minutes in diabetes. It's a wonderful practice for diabetes, for your truncal obesity. And always remember, look at this. I'm not breathing. My awareness in the belly button. What I'm doing, I'm breathing in between without knowing. It is called a passive inhalation. Active exhalation, passive inhalation. It massages your diaphragm, massages your lungs. So all the air comes out. And I keep on changing my mudras. I change my mudras to my, it's called a Vayu Mudra. It massages your heart. Heart is sitting in between your lung. Remember, when you have a heart disease, we try to do a very gentle massaging your heart. In yoga says, if you massage an organ slowly, the organ gets better and better. I got a message here. I don't know, what was it? Anyway, okay. Let me. Balwin, can you record this session too? If you record the session, it's good. I cannot record it now. I lost my. Okay, this is your Kapalbhati Pranayama. Very important pranayama. Bastrika Pranayama, active inhalation, exhale. Many a time we do Bastrika Pranayama, raising our hands high up. Raise our hands high up and pulling it down. Remember, pranayama is a therapy. So if you think your asana practice is just like we call it if it is like a pill, it's like a pill. Active ingredients is your pranayama. And mechanism of action is your meditation. Very important. So you can raise your hand high up and pull it down in a slow speed, medium speed, and a very rapid speed. And you pull it down, you use called Adhi Mudra. So how beautiful it is. You bring it up here, breathe in. With a medium speed. It could be a rapid speed. Generally in our practice, we do 20 in a slow, 20 medium, 20 fast, one cycle. We do it for about 2, 3, 4 cycles. A meditative pranayama is called alternate nostril breathing. Another meditative pranayama, as I said, the Bumble Bee Breathing. Another is called Ujjayi Pranayama. It's called victorious pranayama. We'll finish with them And you will see we'll do alternate nostril breathing without closing our nostril, which is a meditative pranayama. Most important yoga therapy practice is a balancing. What? Health is defined as a balance of your body, mind, and spirit. And let me show you how to practice balance. When you stand up, in a yoga therapy practice, you might like to keep a chair or something close to your hand or body, because we are not ready. We are rogi. We have a disease. So I have a chair here close to you. I'm comfortable standing like this. So yoga says, go against the grain of your habit. Train your brain how to activate other side. Put your feet together. Your hand controls your balance. If you fall down, you will see always fall down in your hand. So take the hand up. Put a prayer pose to the back. If you're doing with me, stand up. Put your hands to the back. Do a prayer pose to the back. Now what you do, you stand on a non-dominant foot. I'm a right-footed, right-handed. See if I can stand on my left foot. I stand on my left foot, 10 seconds, 20 seconds, 40 seconds. By the time I'll be able to do, then you do one impossible task, which is called closing your eyes and able to stay. If you're able to close your eyes and able to stand, this is your absolutely final test for your health. This is a sign of your health. Closing your eyes, able to stand on your foot. I practice every single day. Still, I'm a little wobbly. Still, it is difficult for me. Do it on the other side. Right foot. Use your, close your eyes. After a while, you close your eyes, see if you're able to stand. See, these are looks like very simple practices, but these are wonderful yoga therapy practices. By the time you will do it, everything will come to you. You will be able to do any named asanas you can think about. Balancing poses. In fact, when you are totally relaxed, you see how simple it is, okay? This is a wonderful practice. You put your hands to the back as a prayer pose. Try to do with me if you can. You will be a completely disease-free. Do a tree pose, Brikasana. Slowly bring your feet. Try to bring your feet above your knee. The tree pose. In a tree pose, your hands to the back, you will see it is a little bit more difficult. When your hand is in the front, it is easier. Now in this posture, you do Kapalbhati Pranayama. In this posture, you can see we have a health tracker. You will see your heart rate will come down, blood pressure will come down, your whole health parameter will get better. Another very powerful yogic practice is called head below your heart. What the head below your heart does, when you put your head below your heart, pressure inside the head goes high up, pressure inside the eyes goes high up, pressure inside the neck goes high up, and you feel miserable. You cannot talk. You cannot even breathe. You cannot even function. You're watering. But if you keep your head down, slowly and slowly, intracranial pressure will come down, intraocular pressure will come down, intracarotid pressure will come down. You feel a profound level of relaxation. Then you will be massaging with the Kapalbhati Pranayama. It will massage your abdomen, massage your pelvic floor. The Sanskrit name is called Prasharito Uttanasana. Prasharito means widespread. Uttan means put your head down, and then slowly you will be doing Kapalbhati Pranayama. So try to do it if you can. Keep on separating your feet and try to drop your head down. Best way to do, put your hand on the knees, slowly support yourself, and put your hand, if you can, all the way down. Your feet will spread almost like the width of your mat. Head down in the ground. Touch both the ankles here. Now you do Kapalbhati Pranayama. And slowly come back high up. It is so interesting that when you are able to do all this stuff, everything comes to you. You will be able to do, say, I want to do a sun salutation. You'll be able to do 108 sun salutation, not even 2, not even 4. We do 108 sun salutations during our practice. You do sitting down postures. In sitting down posture, most important is a lotus pose, thunderbolt, and a squatting. These are all primarily your relaxations. Standing up, most important are balancing poses. Next is your head down below your heart. And these are same phenomena. You do a headstand. People ask me, I want to do a headstand. As a very simple, oh, I have a contraindication, I have a hypertension, I have a heart disease, I have my neck problem. Listen, when you listen to your body's signal, nothing happens. You feel very clearly. So, it's not your age, it's how to prepare, okay? Let me show it to you how to prepare yourself so you will understand how important yoga therapy is. So you will be able to, if you can sit down in a thunderbolt. This posture totally relaxes you. If you want to try with me, you can do it. You will see how wonderful practice it is. Hands here. This is your stance. Put it in the ground. Clasp your hand, put your head down. And you feel miserable. You cannot talk. You cannot breathe. Your head is flushed. Keep your head down. 1 week, 2 weeks, maybe 3 weeks, whenever. You'll see your breathing will get normal. Your head flushness will go away. You will feel comfortable. Stand up. You keep walking. And your body will go high up. Body will go high up and keep going high up, and you don't push. If it doesn't go high up anymore, you come down. Nobody's touching you, nobody's helping you, and your whole body will go high up on its own. You are not taking any pain medication, your neck is not going to bother you, nothing is going to bother you. Your whole, I do it every single morning. This is not the right time. We do it first thing in the morning, we're almost midday. So I just want to show you the technique. Then what will happen, next thing, you always fall down in the front. When you always fall down in the front, you practice. You become like a baby. Watch me. If you're watching Balwin, if you're watching me, watch me. It's a very important phenomena to be a yoga practitioner. Put your head down, like a baby, and you see, nothing happened to me. I'm in a total control of myself. I fall down in the front, prepare my body, I prepare myself for a headstand. Same, I can do shoulder stand, anything I can do. Handstand is very important. Hand strength, hand balance. Or for chronic low back pain, what we'll be doing, you'll be doing back bend on the mat. Back bend on the mat is like your cobra pose, locust. your bow pose. You know all the poses? Because we are coming close to the time. I'll give few minutes for you. There's a headstand going on there. I see beautiful way of doing it. Perfect. But that is the way you learn. Learn keeping your head down and listening to your body's signal. Same way. It's a very difficult, people say difficult asana. There is nothing called difficult asana. Peacock, Mayurasana. In fact, it's called a female pose. It's called a Mayuri asana. You do a lotus first. Do a lotus first, Padmasana. You do a Mayurasana and a Padmasana. You do go your body high up, your whole body goes high up. Mayurasana in a Padmasana. So I'm not trying. This thing is coming to me. And when the body gets prepared like that, and when my breathing is totally effortless, how do you know my breathing is effortless? You notice it. Every asana I'm doing, I'm talking, I'm even singing. I'm in a headstand, I can talk, that my breath is essentially normal. A very meditative practice. A meditative practice is called a chin lock. In a chin lock, when you put your chin down, there's a 3 locks called chin lock, abdominal lock, and a root lock, regret lock. But a yoga therapy practice is a chin lock. What a chin lock does, it massages your carotid sinus. It brings a profound relaxation response. Then you do called breath holding. Breathe out first, take a deep breath in, breath hold, do a chin lock, and that is called your Murcha Pranayama. Murcha Pranayama means it's called your, almost like you're fainting. That makes it so relaxing. Let me practice you. The next we'll do Ujjayi Pranayama. Ujjayi is closing your throat, trying to breathe in against the resistance, and we'll incorporate this chin lock. Show it to you one time. Use your hand, use your Adhi Mudra, thumb inside and close. That's a relaxation. Breathe out first. Take a deep breath in. Hold your breath. Close your eyes. Slowly keep your neck straight. Slowly drop your chin down. Touch your chin to the chest. Stay here as long as you can. Slowly come back. These are actually called meditative practices as a yoga therapy. Therapeutic, we do a called chakra awakening meditation. That is called your therapeutic meditation. Or if you do a Ujjayi Pranayama, with victorious, trying to close your throat, trying to breathe in and incorporate a chin lock. Let me show you to you one time. When you get a little cough, that means you have constricted your larynx. Breathe out through your left nostril. It is called your Chandra Nadi, the moon energy. So all the cooling, relaxing practices. Let's finish with a meditative alternate nostril breathing. Alternate nostril breathing is called Anulom Vilom Pranayam. Generally what you do, use your left hand to use a mudra called Adhi Mudra. touch your index finger and thumb, put it here. Close your right nostril with the thumb. You don't have to push all the way down, just close underneath your nostril. Breathe out through your left nostril. And breathe in through your left nostril. Close your left nostril and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Slowly you bring your index finger and middle finger in between your eyebrows. Bring your awareness, close your eyes, bring your awareness in your third eye. Then with the left hand also hold your right earlobe. That is called super brain yoga. It's a balancing. Now you continue your alternate nostril breathing. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril and breathe out through right nostril. And completely do it in silence. Keep on doing it. Let me explain to you. Left nostril is controlled by the right brain. Right brain is analytic. Right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Left nostril breathing is parasympathetic, cooling, moon energy, chandranari. Right nostril is your control by your left brain. Left brain is analytical. Left brain is male, left brain is heating, left brain is sympathetic. It activates both sides of your brain. It is wonderful practice to improve your memory. It is wonderful practice to balance your high blood pressure. Wonderful practice for your Alzheimer's disease, dementia, all neuropsychiatric disorders. When you keep on doing it, slowly and slowly you enter into a state of meditative practice. You enter into call your gross body to subtle body. The three bodies, gross body, subtle body, and causal body. Then what will happen, you will practicing. See, when my body and mind is together, my eyes are closed, I can easily access any part of my body. See, with my right index finger, I can touch the tip of my nostril. And my eyes are closed. I'm touching the tip of my left index finger. I'm touching the top of my head. In the same way, touch both of your index finger and thumb. Keep your spine straight. Bring your awareness in your nostril and do the breathing through your nostril as called your guided meditation. The first, you will do all things in silence, but I'm telling you how to do it, but you do in silence. First, bring your awareness to your nostril. Breathe through your nose. Never breathe through your mouth, because if you breathe through your mouth, you don't know where the air has gone. It can go to your stomach, go to your lung. Breathe through your nostril. Air goes through your nostril. Air first gets filtered. Your nose is like your personal air conditioner. If outside air is warm, it will cool it down. Outside air is cool, it will warm it up. Air goes to the side of the nostril, called turbinate, and it goes into your larynx. It's going into your lung. Air is going to the upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. In the belly button, the breathing stops, called Kebal Kumbhak. Visualize breath is coming from lower part of the lung, middle part of the lung, upper part of the lung. Breath is coming out through your nostril. Outside nostril, the breath picking up prana. Prana is a subtle energy which keeps us awake, alert, and alive. Breath is not the prana. Metaphorically, Breath is like your electric cable. Prana is like the electricity. In yogic tradition, our whole body does the breathing. Slowly visualize the breath is bringing prana. Then the prana is going to the organ of healing. I have a problem in my heart. I'm visualizing prana is coming to my heart, causing the healing of my heart. I have a back pain. I'm visualizing prana is coming to my back, causing the healing of my back. I have a problem of my knee. I'm visualizing prana is coming to my knee to do the healing, called the pranic healing. Once the pranic healing is over, I slowly bring my awareness to both the nostril, and in the silence, I do alternate nostril breathing without closing my nostril. It is possible. Take a look at me and you'll understand. I'm breathing out through my left nostril. I'm breathing in through my left nostril. Breathing out through my right nostril. Breathing in through my right nostril. Breathing out through the left nostril. Keep doing it in silence and do it for a few minutes, and you will see you will enter into a profound meditative experience. In that time, I can feel my touch in my finger is going down. I can feeling the pulsation of the capillaries. My heart rate is down. My blood pressure is down. My blood sugar is down. My respiratory rate is down. I'm in a profound level of healing. Meditation is medication. Difference between the two: meditation has one T, medication has one C. Meditation is called, the T is called art of transformation, C is called a choice. Either you take your pills or do yoga. Slowly you can bring your hand in front of you, touch your little finger and thumb, separate your ring finger, middle finger and index finger. This is called Padma Mudra, Lotus Mudra. It connects your body, mind and spirit. Slowly you can bring it close to your heart. Heart is a site of your soul. A practice of yoga causes wellness, physical wellness, mental wellness, and spiritual wellness. This wellness acts as a preventive medicine, therapeutic medicine, and prevents tertiary complication. Slowly bring your hand in front of you. This is called a namaste. You put your hand in front of your heart chakra. Slowly bend your head down. And I honor the divinity within you. Finish with another palming and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, you can remove your glasses. Take your hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face. Massage your ears, very important. Back of your ear, front of your ear, inside your ear canal, and then slowly massage your carotid sinuses. And in the back, it's a profound relaxation response. You're all well, you're all healed. You keep doing, and in Sanskrit, the word comes, it says, Karo Yog, Raho Nirog. Karo means do, practice. Yoga is yoga. Raho means stay. Nirog means disease-free. Thank you. Thank you for your time. Thank you for your attention. And you can take my spotlight away, Baldwin. Put us on a gallery mode so you can see everybody. And you can all unmute. If you have any question, I know it's hard for me to read through your chat. You can ask. I'll be glad to answer. We have a few minutes, or if you want to finish, it's fine with me. It's all.
We have one question.
Sure.
Someone is asking that for the lower back. I think you feel free to please talk to Dilip ji.
Sure. Go ahead. Please ask the question. Unmute yourself and ask the question.
Namaskar, Dilip. Namaskar.
Namaskar ji.
Thank you so much for such a lovely session, so much of efforts, genuine and sincere. Thank you so very much.
Okay.
And I am suffering with a chronic back pain that's upper and lower, especially around the muscles of lower back pain. I mean,
Yes.
lower back.
Mhm.
And I'd like to know what are the do's and don'ts when I'm doing all the other asanas that could be avoided. That's generally forward bending. And if I'm doing some exercises, asanas for my back pain, then what is the right way of doing it, sir?
First of all, as I said, do not do any practice after taking a pain medication, okay? Even if you have a pain, do the asana practice even with the pain. I will tell you, because a Bastrika Pranayama will reduce your pain. Second, listen to your body's signal. Do not cross your pain. Do not be sure your breathing is effortless. Now, pain in the back, pain in the neck, for all of us, we had a serious pain. Pain comes from an